come to school sick and things like that. But getting back to it, I guess what I want to be clear on is, like, I'm not so sure I understand where you are in terms of what the Republicans are offering, which doesn't help my family, and what President Obama is currently, what he rolled out. He didn't get to roll out what he really wanted because the Republicans have been blocking. He can't get anything passed with gridlock right now, which is really a shame. But, what would you do? How would you help my family? How would you help middle-class families who have kids in college, kids still in high school, two paycheck family members that work really hard, and like what could you offer that's different from, well, obviously Pledge to America, that doesn't help me at all, but what could you do to either enhance what is under current?
Sure, let me get to the suggestions, but honestly, what I told you was I think that's the best thing, because again, like, the government is actually sponsoring this group or cartel that's controlling the healthcare of our country. But there's a couple other problems with the healthcare bill, and I guess I'll also add that currently I'm uninsured, and what I pledge to do with my salary again is to donate it to local nonprofit hospitals, because I do think that that's something that really needs to be done. And when you have a wealthy society, that's when you're actually able to provide health care to the poor. But the two biggest problems, and I would work with every side to get it done, but the two biggest problems with the health care plan that I see is, number one, is the actual mandate. They mandate that you have to be covered or you will be fined and imprisoned. And that's oh yes, it is.
We better do some research.
I've read the bill.
I'll email you.
Oh,
I don't believe that to be true.
Oh, no.
It's in the bill. If you read the bill, it's in the bill.
Well, I'll beg to differ, and I'll send you the information.
Sure. And the bill text, just so you're aware, it does say very plainly that there's a fine, and then you have to go in, like, the problem with these bills that they also write, and again, this is a 2,000-page behemoth, but you have to actually go into the USC code a couple times, and when you go into that, it's like, okay. So that's actually there.
I'll definitely get back to you on that.
And the second major part of the bill that I object to is actually, the bill is also changing the labor laws, and it kind of sounds like a good thing, because one of the things that they're doing is they're forcing employers to pay for more health care of workers. But the whole bill, if you recall, is intended to actually help the poor and the neediest. But what these labor laws are actually going to do is, by forcing the employers to pay more, if you're a marginal employee making $10 an hour, like, if you're making $30, $40 an hour, the employer will probably be okay with paying a little bit, they'll make less profit. But with the marginal workers, they're literally going to be put out of work, because the government, on top of all the taxes that they already pay, they're going to be paying an additional 5 or 10% on top. And again, as an employee, there's no reason to have a job if you aren't able to generate some type of profit for your employer. So it's going to really, and I have it referenced also on my healthcare plank, which is on my website, and I can either email that to you as well, because it kind of has all these things linked. But it's really going to, I believe, devastate the poor and the middle class, which is the very area that it's pledged to.
But if they're going to be insured, how would that won't? I don't see how that would hurt them. How is that going to help them? They're going to be insured now for the first time. They're going to have.
But they won't have a job. That's the problem.
Well, wouldn't it be good to be healthy? I mean, if you could have nothing, be sick and not have a job. I mean, what is it? Why would you want a job if you didn't have health? I mean, I just, I guess I look at it really.
It's like this, because another thing
how can you work if you don't have?
Let me go into the solutions that I have, and some of those solutions that are actually, I'll fly over there. What I'll be offering, and I'll submit a bill for it, because that's one of the things that any member of Congress can do is submit a bill. I'll be putting in bills for any premiums or out of pocket healthcare expenses that you could subtract that dollar from the federal income tax that you owe. So that's something that'll be out there, and it'll make, again, if you want to actually help the poor and the middle class, it's going to help them out quite a bit. I'll also, for instance, if you have children with terminal illnesses or any type of cancer, and even if you yourself are afflicted with it, to free up the pain, stop paying like the Social Security taxes and other payroll taxes, because when you're afflicted with these things, or your children are, it's a lot more important to have the money to come home at the current time rather than to pay it into the Social Security kitty in the future. And that was the last thing I wanted to go into. So those are the solutions that I had. And again, like I disagree with the current healthcare legislation. And one of the other things that I hear from a lot of people is, well, Britain and France, they have these wonderful healthcare systems set up. Why can't we have it here in the United States? And on a state level, it actually might be possible because there's two main differences in the federal budget. One is that we spend about almost $1.5 trillion on our military, their warfare expenditures, and our foreign policy abroad. Another $1.5 trillion roughly is the Social Security and Medicare, and then we spend another $1 trillion on just all their other departments. So if you actually, and when you go in and look, so we're at 25, 30, 33% of our budget is going towards warfare. Yet we don't defend our own borders. But these European countries, we're defending like the borders of Germany. We have 55,000 troops in Germany. We have 10,000 troops in Italy. They're spending a very, very small single digits, 2 to 3% of their budgets. So if you remove that, then yeah, technically it would be possible. But the better thing to do, and the other problem that you have, is that the population in the United States is 310 million people. When you go over, and the population of Pennsylvania actually in favor of this is about 12.5 million. When you go and take a look at any of these European states over there, you also have these nation states that have a much lower population, and I think that that's one of the things that Pennsylvania can try, and Massachusetts have tried too, if they so wish, is to try and do things. But I think it's very dangerous, and if this one-size-fits-all policy doesn't work, if it hurts the poor and the middle class because they don't have jobs or anything anymore, and you have to remember too, for the first 4 years, it's basically just a tax. It's $1 trillion tax. We're not going to see too much until a little bit later on. So they say, if the dollar holds up in the plan. But that's the problem that I think needs to be taken a look at. You have to look at the economics of it, and you have to address the true problem is cost. Like when you look into tort reform, the cost of defensive medicines, and all these mandates that they have. Yeah, it's a complicated problem that needs to be addressed, and that's sort of the things that I have listed on my website. Those are the better things to do, rather than to try to stick everybody into a healthcare plan that won't work.